Hello, and welcome to Your Health Matters. I'm your host, Dr. Peter Hogenkamp, and today in the program, I'm going to be discussing the third in a series of the hidden health hazards of summer. We've been talking about this for the last couple months, and I wanted to just reiterate, summer is a great time. I happen to love summer. It's my favorite time of the year. But unfortunately, summer is fraught with a bunch of problems that aren't necessarily obvious, and that's why I'm calling them the hidden health hazards of summer. What could be more hidden than tick-borne illnesses? We live in Vermont here, but if you're watching this program on pegtv.com or some other channel, ticks are prevalent throughout the United States and the world. So no matter where you're watching the show, you need to be aware of ticks. When we talk about preventing anything, the first step is always awareness. So you need to be aware of what ticks are around where you live and what diseases that they carry. I'm going to focus mostly on things that we see here in Vermont, but these are typical for the Northeast of America, Europe, mid-Atlantic states in America, throughout the country. So, where do you find ticks? And the answer to this is a little bit unfortunate because although most ticks are found in the outdoors, I did have a lady recently who I ultimately diagnosed with Lyme disease. And I have to be honest with you that when she came in feeling poorly, and I'll talk about the symptoms of Lyme disease later, it never occurred to me that she might even be at risk for Lyme disease because she never went outdoors. She admitted to me, this woman, the only time she ever left her house is to come to the doctor's office. And so I wasn't thinking that this woman was at risk for Lyme disease. However, she had a cat, and the cat did go outdoors. And ultimately, we found out that her cat, who was not being treated to prevent ticks by the cat's veterinarian, the cat brought in a tick, then detached, got onto her, and she got Lyme disease. So just keep in mind that it is possible, even though you're not spending a lot of time outdoors, that you can get Lyme disease or other tick-borne illnesses, and that's generally through pets. That said, most of people who are getting Lyme disease, most people who are calling me about ticks, are people who are spending time in the outdoors. The most common place in the outdoors are areas where there's long grass. Long grass and shrubs are generally the areas to be avoided when we're trying to keep away from ticks. However, the leaf litter in the forest, so any kind of wooded area, will also have tick nymphs and larvae as well. So those areas you have to keep in mind as well. So what does that mean? That means when we're hiking, when we're walking, when we're doing yard work, when we're playing with the dog, all these things that we love to do, especially during the warm months of spring, summer, and fall, we have to be careful about ticks. So the first thing that I tell people about tick avoidance is that I want you to avoid ticks. I don't want you to avoid the out of doors. One of the things that I'm most passionate about in my life is spending time in the outdoors. Not only passionate myself, but for my family and my patients as well. I'm always encouraging people to be out of doors. If you're interested in the health benefits of being in the out of doors, I did a program a couple of years ago, which you can find in either my channel or the Peg TV channel, a YouTube channel, about the health benefits of being outdoors. There are many health benefits to being outdoors. I want you to be outdoors. But I want us to be outdoors mindful of the concern about ticks. If you're just going to stay inside all the time, the ticks have already won the battle. They're keeping you indoors and you've already lost. I don't want you to do that. But when I want you outdoors, I want you being smart and being aware. So the best way to avoid getting Lyme disease is to avoid ticks. I wanted to start off by talking about what ticks there are in Vermont. There are actually 15 species of ticks in the state of Vermont. There's more throughout the country. But I'm going to simplify it right away and tell you that the really only species we need to worry about is the black-legged tick. Over 99% of tick-borne illnesses in the state of Vermont are borne by the black-legged tick. So let's talk about the tick. I want to talk about the life cycle of a tick, something that you didn't think you were going to be thinking about today, but it's important when it comes to the actual disease and disease transmission. So let's talk briefly about the life cycle. So ticks are born or are laid by adult female ticks, and they mature in the summer. Or they, the eggs mature into larvae in the summer. The larvae then in the fall become nymphs, which then become adult ticks. The stages that we have to worry about are the nymphs and the adults. Those are the only two stages of ticks that will transmit Lyme disease. Larvae will not, but the nymphs do and the adults do. The reason that we fear the nymphs the most is because the nymphs are extremely small. And being that small, sometimes you can miss them. It's amazing to me how people come in sometimes. I've done skin checks on people and found these ticks that they just haven't seen because they're tiny. Tiny, but possibly also very dangerous because they can transmit the disease. So where do we find these things? Well, the nymphs tend to be in the leaf litter. On the lower vegetation, the adults tend to be on the higher vegetation where they can pick up deer. The nymphs are on the low vegetation where they tend to pick up or look for, quest for is the actual term, they quest for white-footed mice. So we always talk about deer ticks, and in fact the other name of the black-footed tick is the deer tick. But one of the common carriers of this tick is actually white-footed mice. Some people will tell me that they go to great lengths to keep deer out of the yard because they don't want ticks there. The problem with that is white-footed mice actually carry the ticks as well, and you go and try to keep white-footed mice out of your yard, it's almost impossible. Okay, we now know who the enemy is. That's the black-legged tick or the deer tick. How do we prevent them? Well, the first way to prevent them is just to avoid their habitat. I talked about that before. But it's a tough thing for me to say. These are hard words for me to spit out of my mouth because I don't want to avoid the wooded areas. I love wooded areas. I don't want to avoid grassy areas. I love them. I love the out of doors, and that's where ticks are. But just keep in mind, when you're out there, you've got to be mindful of these things. So one thing that I've done quite a bit is I've started to hike more on old country roads and logging trails versus hiking trails, especially during peak tick time. And it's a kind of it's hard for me to even admit this, but I've changed my behavior because of ticks. I'm still out there, however. I'm still doing the things that I love, but I'm being just a little smarter about it. I like to some of the roads I like to walk on are Wheelerville Road, the Wildcat Road, River Road. These are great roads, and I'm not at risk for ticks on these roads. So if you're going to be on a trail, hike in the center of a trail so that you're not brushing up against the vegetation that's on the sides of the trail. That's where the ticks are. Look, they're questing. That's where they're questing, looking for you. Because these ticks need to feed on your blood. And so in order for them to survive, they've got to be out there. Be mindful of it. The next thing is obviously long clothes. And I specifically mean long sleeves and long pants, hats and high boots. So if you're really going to be doing this right, and I see a lot of people out there hiking with me doing this right, you're going to be wearing long sleeves and pants that are light in color. I was going by this woman one day, and she was wearing white. She had all white clothes on, and I have to admit, she looked kind of incongruous out there in the woods. And I said to her, I should have known, but I said to her, it's unusual for you to, for someone to be wearing white out in the woods. You wouldn't think of that. And she's like, the white shows the ticks. and it was a great point. I tend to wear khaki colored clothing, which is also clothing that's very suitable for the outdoors, but any kind of light clothing will do. You can see the ticks and brush them off. Tuck your pants into your socks. I know it looks goofy, but it's very, very good, because otherwise the ticks will get onto your pants and they'll climb down and then climb over your sock onto your leg. Trust me, I've been out in the woods wearing long clothes, and I've gotten home and I've found ticks on me. The third thing is, and this is probably the most important thing, are tick checks. So when you're out in tick habitat and you come back in, you want to take off your clothes. I tell people I always take a shower every single time I get in from the woods, whether or not I've gotten dirty or sweaty, because it's a tick prevention method. The clothes should either be then left in the garage for a long period of time, or washed in hot water, or put in the dryer under high. Lukewarm water will not kill ticks. High heat will. So oftentimes I'll just come in, chuck all my clothes into the dryer, put them in the dryer for half an hour on high, and then as I do that, I'll then go take a shower and look for ticks. The places you need to look for ticks are very important. Unfortunately, they tend to get into the hair, which is one of the reasons I love when people wear hats to prevent that. That said, I've seen people who've had hats on who then I found a tick in their hairline. You want to look around the ears, you want to look under the armpits, you want to look in the groin, you want to look on the legs, especially the back of the legs, and on your back. It's good to use a mirror in this circumstance. It's good to have a tick check partner so they can look at it as well. I know this sounds a little goofy, excuse me, but tick checks are really important, and I really need to insist upon them if you're going to do them. Removing a tick before it attaches is the best way to prevent Lyme disease. Now, if you do find a tick that's attached, the first thing you want to do is remove it. Best way to remove a tick is to take a pair of tweezers, use gentle but firm pressure on the head of the tick right at the level of the skin, and pull up. It's amazing to me how often I've seen patients in the office who've come in only for me to take a tick out. It's really easy to do at home, just using a pair of tweezers. There are tick little devices that we give out at the office, for instance, or you can buy them at the hardware store, grocery stores, pharmacies, that'll take ticks out as well. Any of these are good. What I don't want you to do is use any type of chemical, and I'll tell you why that is. I've had patients tell me that Vaseline works, nail polish works, alcohol works, or applying, putting a lighter near them, that's on, and they put the heat on the tick. All of these things oftentimes force the tick to eject the disease-laden saliva of the tick into your skin. So that can actually cause transmission of Lyme disease, whereas otherwise you wouldn't have had it. So don't do that. Take the tick out with tweezers. If the tick is attached at all, if you're going to take one thing home from this talk, this is what I want you to take home. If the tick is attached at all, that means the tick is not walking on your leg and you brush it off, but it's actually attached into your skin. I want you to call your healthcare provider, and I want you to get 2 pills of doxycycline, which you're then going to take ×1 with some water to prevent the transmission of Lyme disease. This is something that we've been doing in our office for years. It's now recommended by the CDC. And I was looking for a study on how efficacious it is, but there weren't any, and I can understand why it would be impossible to really come up with numbers on this. That said, in my practice, where we have thousands of patients, where we've been taking care of patients for years, I do not have one single case of Lyme disease in a person that had a tick bite that was attached and took 2 doxycycline. This has still not come across my desk. Now, it's possible that it's happened, but in 20 or so years of treating Lyme disease, I haven't had this fail yet. It's very important that you do it. Now, the CDC used to say that it took 48 hours for a tick to be on to transmit Lyme disease. They've now come down to 36 hours. But that's not the rule I use. The rule I use is if it's attached at all, even for a couple of hours, I want you to call your doctor or healthcare provider and get 2 doxycycline. I have had 2 or 3 cases now where patients, they were absolutely certain that the tick was only on for a few hours. They knew this because they had seen a tick on their arm, whereas 3-4 hours it hadn't been there. And they didn't call me because they knew it was only on for a couple of hours, and they ended up with Lyme disease. So it can happen. If it's attached at all, I recommend that you be treated. The next point is pets. It's a point I made earlier in the program. If you have a pet, you have to be very, very careful about Lyme disease. Specifically, I recommend that you have your pet, you take your vet to the veterinarian, and that you get a veterinarian recommended Lyme disease or tick prevention treatment for your animal. The last point is a point I made just earlier, but it's the most important point I'm making today. If you have an attached tick, call your doctor, get doxycycline. If you're allergic or intolerant to doxycycline, amoxicillin can be used, as can several other antibiotics. Okay, so let's talk about tick-borne illnesses. And I'm going to start off with the granddaddy of them all, and that's Lyme disease. Of note, Lyme disease was first found in Lyme, Connecticut, which is why it bears the name Lyme disease. And in the old days of Lyme disease, when I moved to Vermont in 1990, there was no Lyme disease in Vermont. If we were diagnosing with anybody with Lyme disease, it was a certainty that they had traveled down to either Connecticut or Rhode Island or Massachusetts or the mid-Atlantic states. We didn't have Lyme disease here in Vermont. Unfortunately, as a phenomenon of global warming, our winters aren't as cold, and we don't get the winters that killed off the ticks. And every year that goes by, every year that our winters are warmer, we have more and more ticks in Vermont. If you take a look at the number of Lyme disease cases in Vermont over time, you'll see that it's on the upswing. So, Lyme disease is a tick-borne illness. The ticks don't actually have Lyme disease. They are infected with an organism called Borrelia burgdorferi, which is a spirochete bacteria. And that bacteria is then transmitted into your bloodstream by the tick, who takes a blood meal from you. And in the process of taking that blood meal, the bacteria are transmitted. Here's a lot of very important things for you to know about Lyme disease. Number 1, 40% of the ticks caught in traps in the state of Vermont are infected with Lyme disease. 40%. It used to be, I remember years ago, when they were concerned about the percentage of, there's 10% of ticks are infected with Lyme disease. Then it was 20. Now it's 40. I actually saw one study that was saying it was 60 to 70%. We figured this out by putting these tick traps out in the wild, and then the wildlife biologists come and they bring the tick traps over to a lab and they test the ticks in there. One study done in the Northeast, 70% of ticks were infected with some type of tick-borne illness. It's something, it's out there, it's endemic, we have to deal with it. Lyme disease comes in stages. If you take the doxycycline after a tick bite, that's the best way. That's a great way to prevent Lyme disease. If, however, you don't see the tick, and I always tell people, it's the tick that you don't see that gets you. Because the one that you see, you take off and you take the doxycycline. But it's the tick that you don't see that gets you, and this happens a lot. This is a common problem in Vermont, especially during the spring, summer, and fall. Lyme disease comes in stages. The most common stage is stage 1, which we call early localized disease. Basically, that's the bullseye rash. Almost everybody is familiar with the bullseye rash. They've either seen a picture of it, they've had it themselves, or they've seen a friend with it. Everyone in my office has certainly seen the bullseye rash. There have been some great cases of bullseye rash. Some of them look exactly like a bullseye. Others, you have to use your imagination to kind of picture a bullseye. But the idea is that it's a red and white rash that looks like a bullseye. It occurs within 3 days to 1 month of a tick bite. And this is the thing that I think a lot of people don't realize. You can actually be bitten by a tick and come up with this issue 1 month. So let's say you went camping somewhere a month ago, and now you're becoming sick. Well, a lot happens in your life in a month. And a lot of us may have completely forgotten that we've had that bite. So that becomes important for you to think about, for you to mention to your healthcare provider. In addition to the rash, which occurs in 70% of cases, are the flu-like symptoms. And we used to call it the summer flu. Lyme disease was the summer flu. People come to my office now in the summer with fever, chills, malaise, fatigue, headache, and in my opinion, they have Lyme disease until proven otherwise. If you throw the rash on top of that, it's a lock. I treat people with a 10 to 14 day course of doxycycline, and they're fine. This is the second most important thing to keep in mind, because people tend to focus or be very concerned about things like secondary or tertiary Lyme disease, chronic Lyme disease. If you treat Lyme disease in the primary stage properly, none of these sequelae or further stages of Lyme disease are going to happen. So you get a fever in the summer, you may want to just not assume it's a stomach bug or like a summer flu or something like that. You go to your doctor and get this figured out, because the secondary stages and tertiary stages of Lyme disease are no joke. So stage 1, early localized disease, best time to treat. If for whatever reason you don't get treated during this period of time, stage 2 Lyme disease occurs weeks to months later. Stage 2 Lyme disease starts off with the same stage 1 diseases, basically the summer flu again, fever, chills, night sweats, malaise, fatigue, headache. But it also involves organ-specific damage. I had a patient who came in, very athletic young man, and he was feeling absolutely horrible. And when I took a listen to his chest, I wondered if he had pneumonia. His chest was clear. I took a listen to his heart, and his heart rate was 20. The normal heart rate runs from about 60 to 100. Very athletic people sometimes will have low heart rates into maybe drop down into the high 40s at rest, maybe even lower at night. But here's a guy that shows up to my office with 20, and I said heart rate of 20. And I said to him, "Well, I know what your problem is." And he said, "What is this?" I said, "I'd be willing to bet you have Lyme disease, because I've seen several cases where the Lyme disease affects the heart, and in this case, it causes AV nodal disease. It blocks the atrioventricular node in the heart, so it doesn't allow your heart to pace normally. So the ventricle is just beating at an escape beat." And interestingly enough, this guy was doing all right. He just couldn't exercise or he'd walk up the stairs, but if he was just sitting down working, he would be okay. But finally he realized, I got to do something about this. He came in with a heart rate of 20. By the way, he was ultimately treated and is perfectly fine, just for you to know. And organ-specific disease can also be other diseases of the heart, like myocarditis, pericarditis, and it can cause neurological problems like encephalitis and meningitis. It causes all kinds of issues. It can affect the peripheral nervous system, cause Bell's palsy. It obviously causes arthritis, as many of us know. I've had many, many cases of people coming in and with a swollen knee, and they ended up having Lyme disease. These are folks who would have been bitten by a tick some period, in the past. They were not treated. Most of the time, probably that's because they never came to the doctor, because they just, they thought they had some kind of flu bug and they just wrote it out. And then that went away. And then secondary Lyme disease came back, and it came back in their knee. And so what we did was, in these circumstances, I usually check a Lyme titer in these folks, but in these particular cases, the knee was actually aspirated, and in the aspirate, we were able to see the spirochete organisms. Again, all of these people I can think about, all of these people were successfully treated. Keep that in mind. This is a very treatable illness. You know, a lot of the horror stories from Lyme disease came from years ago when we weren't aware of it. And that's what I'm doing here today. I'm making you aware of these things, making sure you know they're out there, and then reassuring you that, you know, these things are treatable. Then there's tertiary and quaternary Lyme disease. I don't really want to talk about those because of limits of time. If I had forever, and you don't want me to talk forever, trust me, but I would talk about those. I do want to take 30 seconds to talk about how we diagnose Lyme disease. That's clinically. You come into my office, you've got a rash, you've got the bullseye rash, you've got fever, chills. I give you 14 days of doxycycline, tell you got early Lyme disease, and pat you on your head and move you on your way. Because oftentimes, when we detect Lyme disease titers in these circumstances, now a titer is looking for the antibody to Lyme disease. The antibodies haven't been made yet, or there's not enough of them in the bloodstream to become positive on a test. As a consequence of that, people may have a false negative Lyme disease. People talk about false negative testing all the time. The lion's share of that is because they're at a period in their illness where there's not enough antibodies. Nowadays, we have something called PCR. PCR is the polymerase chain reaction, and that is actually looking for the DNA of the spirochete itself. You can find this much earlier, but it's a very expensive test. A lot of times we don't order it as a consequence of that, and even very early disease can be missed by PCR. So the long and short of this is we treat clinically in these circumstances. People talk about false positives, false negatives all the time. I think the best approach to this is if you've got a high likelihood of Lyme disease, to treat you and go from there. Stage 1 Lyme disease, 10 to 14 days of doxycycline, you will get better and it will not recur. I wanted to spend the last couple of minutes talking about the two other Lyme diseases or tick-borne illnesses that we see the most in Vermont, that are Anaplasmosis and Babesiosis. The thing to remember about these is they're also found in black-legged tick, the enemy, black-legged tick. But they're actually different diseases than Lyme disease. Anaplasmosis tends to present with the same symptoms, but also some, in other words, fever, chills, malaise, headache, but also GI symptoms, sometimes a cough as well. Anaplasmosis is also treatable by doxycycline. The thing to keep in mind about about anaplasmosis is that it can be a severe illness if untreated, so you definitely want to get that treated. The other illness is babesiosis. Babesiosis is not a bacteria at all, but it's a protozoa, but it is also found in infected ticks. I once had a patient that came in with clear, to me, obvious tick-borne illness. I checked a tick panel, which is a panel of tests, which I order all the time, but it has the serology or antibody tests for Lyme disease, anaplasmosis, babesiosis, and ehrlichiosis, which are the 4 most common tick-borne illnesses in the state of Vermont. This patient had anaplasmosis, babesiosis, and Lyme disease. In other words, this particular tick that had bit him was co-infected with all 3 of these microorganisms. Co-infection happens about 4% of the time. The last point I wanted to make about babesiosis, and this is the 3rd most important point I'm making today, is that babesiosis is not treatable with doxycycline. It is a protozoa. You need to use a different regimen for it. If you're interested, it's atovaquone plus azithromycin. But the important thing to realize is that doxycycline will not work. Babesiosis is very interesting. In endemic places such as Block Island and Rhode Island, 20% of adults and 40% of children had positive antibody titers for babesiosis. And yet these were people that had never experienced symptoms. So it can go from an asymptomatic case to somebody who is severely ill. Thanks again for your participation and attention. Cheers.